The CDC is expected to meet tomorrow to determine whether or not children under 16 years old will be cleared to get Pfizer booster shots.
Well, this comes after the Food and Drug Administration approved Pfizer boosters for kids 12 to 15 years old. Dr. James Schneider, the director of pediatric critical care for Cohen Children's Medical Center in Queens, joins us now to explain what these new developments mean. Good morning to you, Dr. Schneider. Thank you for being here.
Good morning. Thanks for having me.
You know, doctor, so many parents have so many questions. And let's begin with this. The FDA's approval of the Pfizer booster for those 12 to 15-year-olds comes at a really critical time as kids head back to school following this holiday break. So what are the chances now that the CDC will not follow the FDA's recommendations?
Oh, I think we're all pretty confident that the CDC will approve and follow the recommendations of the FDA. And we're all looking forward to kids of that age, 12 to 15-year-olds, including my 14-year-old, and looking forward to them all getting boosted, knowing that that's really our best chance of getting through this.
Yeah, well, of course, parents are very concerned, though, if there are risks linked to the Pfizer booster shots in young children. Are there?
Well, there are very low percentage of risk, and that's true for all vaccines, but that's why we study it very well, and that's why the FDA has gone through the data to ensure that the vaccine is safe. We know there are certain risks, not many, but nonetheless, the risk of getting COVID is significantly higher,
right.
And therefore dealing with a little fever or a little bit feeling under the weather for the day is absolutely worth it.
So let's be specific here, because the FDA based its decision on a study out of Israel, which included more than 6,000 children, right? And I'm sure so many parents just want to make sure that it's safe for their kids, and if they do give it to them, once it is approved, what they are in store for. So what are the negative side effects besides what you just kind of described as a fever or feeling like a cold?
Well, the other one that I think people have been talking about and have concern about is that incidence of myocarditis or heart inflammation. It's exceptionally low risk, and they're very, very mild cases, in fact. And the risk of getting myocarditis from an acute COVID infection is significantly higher and is much more dangerous. So other than that, it's fever and maybe some soreness around the arm, maybe some redness at the site of the injection, but nothing really significant to be concerned about. Like I said, my 14-year-old will be the first in line to get his booster.
Yeah, so if the CDC does clear the boosters, before parents really start making these appointments for their booster shots, how much time should there be between the initial vaccine and the booster, especially since it's changing for adults from 6 months to 5 months?
I think we're going to follow the CDC recommendations, which we have all along. If the recommendation comes out to also only need 5 months in between your second shot and the booster, then that's what we'll do. I think, all along the CDC and the FDA have really looked at the data very clearly and have given us sound recommendations and has led to the success of the vaccine so far, and we'll continue to follow the recommendation.
So the FDA also cleared, doctor, that third dose of the Pfizer vaccine for immunocompromised kids between the ages of 5 and 11 years old. Can you elaborate on that for the parents out there? Does this mean children with medical conditions like asthma, diabetes, severe allergies?
Yes, so immunocompromised just means when the immune system is not able to mount a normal response for various reasons. There are children who are born with problems with the immune system. There are children who develop problems with the immune system because of a second condition, such as cancer and the treatment that comes along with cancer. Those patients are the ones we know all along the pandemic have been the most vulnerable to getting severe infection with COVID. So it's great to know that they are now going to be eligible for the vaccine, because that's really going to be the best way to protect them. And that's also why we all need to be vaccinated, everybody who's eligible, because that will help protect those who are not able to get the vaccine.
So do you foresee that booster shots for that age group, for children that are not immunocompromised, might not be that far from now? Absolutely. I think I'm hopeful it's not far from now, frankly. And I believe that we'll see probably within the week that we'll have approval, and it will start getting shots into arms of younger children, which is going to help us move forward, get through this.
I spoke to Dr. Fauci yesterday right here on this program, talking about what was going on with children in hospitals, right? We're hearing across the country that a lot more children are in hospitals and testing positive. So what are you seeing? Is it kids that are coming in for other things and you have to run the COVID test, finding out that they're positive, or are you seeing that they're actually showing symptoms?
It's a really important question. That's why the governor actually is now asking us starting this week to decipher between the two types of cases. But I could tell you, at least in our children's hospital at Cohen Children's, we are seeing a drastic increase in the number of kids who are being admitted who have COVID as part of the disease while they're being admitted. So we have kids who are here with fevers and respiratory failure. My ICU has seen a 5 or more fold increase in the number of patients. The Children's Hospital has seen at least five-fold increase. And there are some children who are turning to be positive by screening when they're coming in for other treatments, but we're seeing a significant burden of kids now being admitted to the hospital because of the COVID infection.
How old are these patients that are coming in, the children?
We're a children's hospital, so we only treat kids, and we see the entire age range. We have newborns all the way through 21, all of whom are affected by COVID.
Are you seeing any cases of this flu-rona that we're hearing about now, this combined case of flu and coronavirus with children?
We have seen a couple. We're definitely seeing all the viruses that we normally see during the winter seasons that usually keep us quite busy in children's hospitals that last year we didn't see when kids were kept isolated from each other. But now that everyone's back together and schools are open, which is wonderful, we're seeing a little bit of everything, but we have seen some flu. And it's good. It's definitely, we're expecting a busy next few weeks.
Yeah, I just want to clarify what you're saying right here. Are you saying that you're seeing cases of flu and coronavirus in the same person combined?
It's possible. I'm not 100% sure if we've seen both combined in the same child yet, but I know we are seeing cases of influenza, and we definitely, like I said, are seeing a dramatic increase in the number of coronavirus cases.
Got it.
All right, Dr. Schneider, thanks so much for helping us out with so many questions that parents have. We appreciate your time.
My pleasure. Have a great day.